Good day everyone, my name is Ranjan Sairi Ergata from BSN2 12G, and today I am going to perform the parenteral administration, which consists with intramuscular, intradermal, and subcutaneous. So the first thing that we are going to do is we are going to demonstrate the introductory phase, in where we are going to introduce ourselves, explain to the client the procedure that we are going to do, and also answer the questions of our client to confirm what the clients want to do. Hi ma'am, my name is Rajan Sairi Argota and I am your student nurse for today. You can call me Ray. Ma'am, can I ask for your name?
Aida ito,
How old are you ma'am?
57.
Alright. Do you have any medical records?
No?
Thank you ma'am. Rationale. The rationale for this is to build rapport with your patient. The next thing that I'm going to do is I'm going to ask my client his or her comfortability, privacy, and confidentiality. Ma'am, can I ask for your, can you describe the temperature of our room? It is hot or not? So we could adjust it.
No, it's okay.
It's okay. Ma'am, are you fine with closing the door? After doing the introductory phase, we are going to proceed with the next procedure. So the first thing that we're going to do is we are going to check for the doctor's order. So check the medication administration record, or MAAR. So the rationale for that is to avoid the error in administering the medication. Next is we are going to check for the label of medication carefully against the EMAR to make sure that the correct medication is being prepared for our client. So the rationale for that is to ensure that the client receive the right medication or the correct medication. Next is we're going to follow the 3 checks of administering our medication. So we need to read the label of the medication. So first thing that we're going to do, for example, this is the medication. So when we take the medication from the cart, we need to read the medication first. And then before withdrawing the medication, we need to read again the name of the medication to confirm. And lastly, after withdrawing the medication to the patient, we need to read again the medication to confirm. So rationale for that is to ensure that we are administering the right medication to the right client. So the last thing that we are going to do is we need to prepare all the equipments organizedly, and rationale for that is to save time and effort or energy. So the equipments that I have prepared here is I have the cottons here which are soaked with alcohol, the syringe, the 1cc and the 3cc. I have my improvised patient, which are the tomatoes, alcohol for the safety, and last is my improvised medication. That assuming this is my ampule, my trash bin for the cottons that I'll be using later on, and my recording book, or my MAAR. So now I am going to start the assessment or the procedure. We are going to do is we need to prepare the medication ampule for drug withdrawal. So flick the upper stem of the ampule several times with a fingernail. So the rationale for this is this will bring all the medication down to the main portion of the ampule. So assuming that this is the ampule, and then we've got this from the medication area. So we need to check for the ampule, compare to the MAR first. So check for the expiration date and reverse, and if it is correct, calculate the correct amount of the ampule that will be given to the patient. So then after, it should be we should double check our ampule, and we are now getting the supplies. So after that, we are going to perform the hand washing procedure or hand hygiene procedure. So we are going we're now going to open the ampule. So I have a pad here with an alcohol. So we're gonna here around the neck of the ampule. So I'm going to pull it na. I'm going to pull the ampule towards me, so that the break of the ampule will be kanang opposite na, mag-open siya in a opposite way. So assuming na na-open na nato siya, so magkuha ko isa ka syringe where syringe para mo tong mag-draw up sa medication na gikan sa ampule. Okay? So, assuming na diri ang medication, so itap na to siya para ang bula is mawala. And ready na ni siya for administration later. So, ibutang na to siya sa safety na lugar para mahatag na to siya sa atong patient o niya sa ato ang medication. So, ibutang to siya sa safety na lugar kay para ma-make sure. And then, after that, we are going to ibutang at inote na to diri na humanat tagkuha sa medication sa atong MAR or sa atong record sheet na ang atong nako na medication is for sa kaning patient. So for the intramuscular injection, we need to first is we need to check the MAR. So rationale is to avoid the error of administering the medication to the patient. Next is we need to check the label of the medication. So for example, this is the medication. So we are going to carefully read against the EMAR to make sure that the correct medication is being prepared. So rationale is to ensure that the client receive the right medication. Next is we're going to follow the 3 checks again for administering the medication. Read the label on the medication when it's taking from the medication card, before withdrawing the medication, and after withdrawing the medication. Rationale is to ensure that we are administering the right medication to the right client. Introduce ourselves and verify the client's identity using our agency protocol. So we all know that before administering any medication, we need to check that that is the right client to receive the medication, and the other way to confirm that is we need to check for the wristband of the patient. So next, the rationale for that is to enhance the rapport to the client and ensuring that the medication is being rendered to the correct client. So next is we are going to assist our client in a supine, lateral, prone, or sitting position depending on the chosen site in where the chosen site in where we're going to administer our medication. If the target muscle is gluteus medius ventrogluteal site, have the client in a supine position, flex the knee in the lateral position, flex the upper leg, and then the prone position, toe in. So rationale for that, appropriate positioning promotes relaxation of the target muscle. So next is we are going to obtain assistance in holding uncooperative clients. So rationale for that is to prevent injury due to the sudden movement after needle insertion. Next is we are going to explain the purpose of medication to our client so that we can allow the client to ask questions to verify something that they wanted to know from us. So rationale for that is to provide and ensure the client's comfortability regarding with the question and answer portion with the before administering the medication. So now we are going to select, locate, and cleanses the site of the chosen site in where we are going to inject the patient. Select a site free from a skin lesion, tenderness, swelling, hardness, or localized inflammation, and one that has been used frequently. So rationale, this condition could hinder the absorption of the medication and may also increase the likelihood of injury of discomfort at the injection site of the patient. Next is if the injections are to be frequent, alternate the sites. Avoid using the same site twice in a row, because rationale for this is to reduce the discomfort of intramuscular injection. The next thing that we're going to do is we're going to locate the exact site of the injection, apply clean gloves, clean the site with an antiseptic swab using a circular motion. So now we are going to start our procedure. The next thing that we are going to do after doing the hand washing procedure and the hand gloving, we need to transfer the swab between the third and fourth of the fingers of our non-dominant hand. So for the readiness and needle withdrawal or position the swab on the client's skin above the intended site. So rationale for this is this will help and reduce the discomfort of the injection. So next is we are going to prepare the syringe for injection. So I've already removed the needle cover and discard. I will discard this one without contaminating the needle. Okay, so we're gonna top it here to remove the bubbles. So inject the medication using the zigzag technique. So we'll now put the needle here. Okay, so we are now going to withdraw the needle smoothly and same angle of the insertion with the minimized tissue only. So since this is the tomato, we are going to inject the tomato, so we need to get a cotton. And then we're going to wipe the side circularly. And then we're going to discard it. And then we're going to open the syringe. So this is 1 ml. 1, 2, 3. And then 1, 2, 3. And then after that, we're going to get the syringe and discard. And get a dry cotton ball. So for the intradermal administration, we need to check for the doctor's order, check for the MAR. So the rationale for that is to avoid the error in administering the medication. Next is we are going to check for the label of medication carefully against the EMAR to make sure that the correct medication is being prepared for our client. So the rationale for that is to ensure that the client receive the right medication or the correct medication. Next is we're going to follow the 3 checks of administering our medication. So we need to read the label of the medication. So first thing that we're going to do, for example, this is the medication. So when we take the medication from the cart, we need to read the medication first. And then before withdrawing the medication, we need to read again the name of the medication to confirm. And lastly, after withdrawing the medication to the patient, we need to read again the medication to confirm. So rationale for that is to ensure that we are administering the right medication to the right client. So the last thing that we are going to do is we need to prepare all the equipments organizedly intradermal injection. So before I'm going to do the assessment, I will check your intradermal in here part. So I'm going to check for any discoloration. So I would prefer this if it is okay to do the assessment. Okay, since my patient, I didn't notice any discoloration with the skin of my patient, so my patient is now ready for the intradermal injection. And since that we are in the quarantine right now, so I could not really inject a real patient, so I find we are required to perform the parenteral medication with the eggplant or a chicken breast. So I chose the eggplant in where I could perform the parenteral medication. So the second step that I'm going to do is I'm going to pick up a syringe and attach the aspirating needle to syringe. So the rationale for that, I also place the syringe on hypodermic tray, so which is this. So rationale for this is pharmaceutical products for parenteral administration are supplied in various containers. So next thing that I'm going to do is follow the correct procedure of removing a drug from an ampule or vial. So since that we are in quarantine right now, I couldn't make to buy an ampule, so I will just use a water for example as a medication. So and the rationale for this is aspirating needle could be accidentally inserted past through beyond the skin when the intradermal injection is being performed. Insert the needle into the center of the rubber cup and inject the air, keeping the bevel of needle above the surface. So position the injection like this. The air will allow the medication to be drawn out easily because fluids move from area or greater pressure than area. So now I already get the water as the for example as the medication, and I already inserted the needle into in where the medication could be in the syringe. So after doing it, tap the syringe to remove the bubbles that are existing in the syringe, and also the rationale for this is that tapping the motion will cause air or air bubbles to rise at the top of the syringe in this part, and where you can where they can be ejected. So now I am done preparing the syringe and the medications, and now I'm going to perform the intradermal injection. So before performing the assessment, I will get the cotton that has been soaked with the alcohol and do it centered to outside. Now I'm going to get the needle and remove the cap of it by pulling it straight off, and I'm going to enter the needle flatly so that the point of the needle can be seen through the skin, and slowly release the medication. So stabilize the syringe and needle and inject the amount of the solution that has been done already. So the rationale of that, if a small wheel appears, all the solution are in intradermal tissue. So next is I'm going to remove the needle. So I'm going to withdraw the needle
at the same angle that has been inserted, and I'm going to the rationale for that is minimize the tissue damage and discomfort of the patient. So the next thing that I'm going to do is encircle the wheel of our blue or black pen and instruct the patient or the watcher to do not rub the wheel or erase the marks. So rationale for that is massaging the area may interfere with test results and by spreading meds to subcutaneous tissue. After doing the assessment, assist your patient to a comfortable position. Ma'am,
So for the subcutaneous, we need to perform the hand hygiene procedure and observe other appropriate infection prevention procedure for the client. So we need to use our clean gloves. So next is so rationale for that is to deter the spread of microorganism. Provide privacy for the client, prepare the client for the assessment. So prior to performing the procedure, we need to introduce ourselves and verify the client's identity using our agency protocol. So rationale is to ensure that the client that we have the right client to receive the right medication. Next is we are going to assist the client to the position in which the arm, leg, or abdomen can be relaxed depending to the site we are going to use to inject. So next, so the rationale for that is to relax position of the site, minimize discomfort. Next is we are going to obtain the assistance in holding the uncooperative client. So rationale for that is this prevent the injury due to the sudden movement after needle insertion. Next is we are going to explain the purpose of the medication and how it will help the client using language that the client can understand. We can suggest, so we are in the Philippines, so we can suggest Filipino, Bisaya, or English, or other languages that she is comfortable to use while doing the assessment. So includes the relevant information about effects of the medication. So now we are going to prepare the syringe for injection. Remove the needle cap, waiting for the antiseptic to dry. So, remove natin siya. Carefully ha. And then straight off, avoid contaminating the needle. So, ganyan lang siya. So, needle by outside edge of the cup. So, so rationale is the needle will become contaminated if it touches anything but the inside of the cup, which is sterile. So, inject the medication on the chosen site and then grasp the syringe in your dominant hand by holding it between your thumb and fingers with a palm facing inside the upward angle and insertion with the palm downward of 90-degree angle insertion. Prepare the inject. So this is the improvised patient. And then we're going to get a so we're going to inject now. And release. So after that, going to get a cotton and we're going to discard our injection. Ibutang na to ang taklob o i-discard na to siya sa proper na labayanan. Kay rationale for that is to avoid other injury or para ma-ensure na to ang cleanliness and also ang safety sa around sa ato ang hospital setting. So we are going to remove our gloves and perform the hand hygiene procedure and discard our gloves.
okay. Closing tips. Summarize all the documentations that you have done during the assessment and thank your client for participating for the assessment. So, ma'am, I am now done doing the assessment regarding with the intramuscular injection or IM, the subcutaneous injection, and also the intradermal injection. So, ma'am, we will just inform you for the results regarding with the injections and for your medical records. And I thank you for participating for the assessment today, and I hope that you have a great day. Thank you, ma'am. Again, my name is Ranjan Saidi Argata, your student nurse for today. Thank you for participating, ma'am.
And now I am done with the parenteral administration. Again, my name is Ranjan Sairi Argota from BSN 212G. And have a great day, everyone. Goodbye.